Hi, ENA. Mike Hastings here. I want to say thank you for being here with us today. As you know, I manage an emergency department outside of Seattle, Washington. And so I've been living the COVID world since January. We had the distinct privilege of being the first case in the US of having the COVID patients and the first death. So I know the emotional distress and toll that this roller coaster ride of this pandemic has created for all of us. The frustration it places on the communities and the frustrations it places within our own emergency department. So I want you to know that I know what the challenges are when the policies change every single day and sometimes even within the hour. And so I know what that struggle is like. So I also know what it's like to know, am I safe to go home? Am I gonna have enough PPE? Am I gonna expose my family? You know, what that looks like. Thankfully here in Washington, it does appear that we are past our peak. And so, but I want you to know that I'm committed to continue to make sure that you have the tools and resources that you need to do your job. I'm not alone in this commitment. Our board of directors is currently meeting weekly so that way we can stay on top of the ever-changing situation. So thanks to the board of directors for their commitment. Today we have several of them that are on the call joining us today as well. So I thought it's important during this time that we connect. Obviously we cannot connect in person, but hopefully virtually here we can make that connection. Because honestly, the only ones that we're able to connect with right now are really our work families that we spend the most time with. This hour is going to go by super fast. However, I do want to share some updates with you, but most importantly, I want to hear from you. I encourage you to use the chat feature or the Q&A feature to share stories and ask questions. We'll try to share as many of those stories and to get to your questions as we can. Any questions that we cannot get to, we're going to try to correlate those and get some answers out to you. Also, we're looking at making this kind of a series, and so we'll use some of those in our future updates as well. So one thing that I've been committed to this year is that notion that one person can make a difference. And so I would love to hear your stories on how you are seeing emergency nurses rise to the face of this pandemic head on and share stories of individuals making the difference. So some housekeeping things. This is being recorded as well. So, so just so you know, that's the way you'll have access to it in the future here for you. And like I said, please make sure that you're using that Q&A feature for any kind of stories to share or any questions that you may have.
So Mike, our first question, I would say, Mike, our first question is to talk a little bit about moral distress and building resiliency and about the nature of transparency with leaders in the organization through a crisis like this.
Yeah, so thanks for that question. So one of the first things as far as that moral distress, so this is something that, I mean, as ED nurses, we face on a regular basis, right? Where we're faced with situations from moral distress. Obviously, right now with this pandemic, we're facing the situations that we see on the news, like in New York, and where we're talking about crisis standards of care and potentially people that are having to say, you know, who is going to get that ventilator and who is not. Obviously, we see people walking into our emergency departments, and then within, you know, a short period of time, we're having to put them on a ventilator. Most institutions have locked it down where there's no visitors in there, and so it is the nurse that is there at the bedside with that person that is experiencing that respiratory distress or is passing away. So, I mean, it's extremely hard and difficult to have that resiliency to that because this is what we're facing day in and day out. So one of the things we're going to talk about is self-care and how do you make sure that you're maintaining your own self-awareness of how you're handling the situation, but also within your peers and how they're handling the situation. So we have some things that we're going to talk about here in just a minute about that self-care off of it. As far as the other kind of question that you raised there, as far as transparency with administration. So I know that this has been a frustration with a lot of people where they feel like administration does not understand what we're doing. They don't see them on the front lines with us. You know, for those situations, I'm truly sorry if you're not hearing from your administration that you're not seeing that support from them. I can tell you where I work at, yes, my administration is not on the front lines here with me. They are playing a much more important role and a supportive role in making sure that we have resources that we need. So my hope is that everybody is having that support and from the administration. Unfortunately, we don't always see them. And I get that from the frontline perspective because we do want to be able to see them. So if you have questions about that, you know, I would raise that up to your administration and be like, hey, is there a way that you guys can come down and just round on us every once in a while and check in with us?
So Mike, our next question from Sally is, what is ENA doing to support nurses that speak up about unsafe working conditions and are being punished for doing so?
Yeah, thanks for the question, Sally. So ENA has put, a couple of the things where we know that nurses were speaking out and that they were getting backlash on was about PPE usage and using their own PPE. So ENA did put out our statement on that as far as that we believe that, nurses that we should be able to wear our own PPE if the hospital is not going to be able to provide it. I can tell you, it's not about an image of a hospital or anything. It's about maintaining our own safety, right? Any course that we ever take is about the first thing that we have to do is make sure the scene is safe, that we have the personal protection equipment on that we need. So, I've been in touch with several nurses that have been in these situations. Unfortunately, there's not a lot that we can do to change hospitals' policies off of that. But I am working with those nurses individually when I know about those cases to figure out what kind of support that we can do for them.
So we have for Kimberly, she asks about resources for compassion, resilience, and she was kind enough to share with us some materials from the state of Wisconsin. But the question is, what do we have in terms of resources that talk about compassion, resilience, or what are some of the things that you've experienced, Mike, relating to compassion, resilience?
Yeah, so actually, if we want to, I think it's the next slide there, actually, where we talk about some self-care. And so we do have some topic briefs that are off of it as well. So I encourage people to check out those topic briefs around compassion fatigue and the well nurse. There's a great presentation also there about stress fatigue and burnout, of course, that Cheryl Randolph did at one of our ENA conferences. It's a great presentation, so take a look at that. But we also have several other different resources that are on our ENA resource page for COVID. So we've actually been working with several different agencies and partners to make sure that we have resources that are there for you. So please make sure that you're checking out that COVID resource page under that self-care, I think is the heading off of it. So that way you can see it. Also under our member resource, I think it's under member resource, and I should know this off the top of my head, but I don't, because I just go to the link. Honestly, there's a bunch of other wellness things that are there for just our members as a member benefit to our members, just to help focus on self-care and how you're maintaining your own self-awareness and how you're handling through this. And as far as like one of the questions, Dana, you said about like, what am I doing, right? So I'll tell you, like, again, just to reiterate, I've been going through this since the end of January here where I'm at. Honestly, this last weekend was my first weekend that I've had off. I've worked every single day since then. Thankfully, because of our volume has gone down a little bit, I was actually able to take a weekend off. So what did I do on Saturday? I actually cleaned windows. Not anything fun by any means, but I can't go out and do anything. But it's just being away from the situation that allowed me to have some self-awareness and quiet time where people weren't pulling me in multiple different directions and needing something from me. So it was nice to be able to just kind of get away. And actually, my boys actually left me alone for a little bit for the most part, so that was kind of nice. So just try to find out ways that you can try to maintain your own wellness. So is it going outside for a walk? Is it chatting with your friends on the phone? Is it sending text messages even to them? I can tell you I've had several text messages from around the world, actually, just to check in and make sure that we're doing okay. And so those little messages mean a lot. It doesn't seem like it's a lot, but making sure that you're reaching out to your friends and your coworkers as well on their days off just to say, hey, great job, you rocked it last night. That was a tough case, just want to check in with you. So those are the things that will really help us make sure that we are staying safe and that our peers are staying safe throughout this time.
So in that respect, Mike, we've also got a couple more questions that tie back to sort of reflection on what people are experiencing. We've got right here from one of our attendees, wanted to share a little bit of their perspective. This attendee says, I've been tangentially involved with standing up at a major city convention center emergency center. The center has no hospital tie-in, and specifically hospitals in the area have said they cannot be relied upon to take COVID-19 patients that come from this 1,000 bed facility when they need a vent. The response has been that the center has to manage them with no vents available to them, and the ratios are about 25-1. Mike, what type of things are you hearing as these larger scale operations are coming into place, and obviously that's creating an additional burden on nurses who are working. What are some of the things that you're hearing and experiencing?
Yeah, so I'll tell you, one of the key things for this is definitely to make sure that you're tied into your emergency operations center within your county. So any time of a disaster is maintained locally and maintains local control. And so typically what we'll see is like a hospital, the city, to the county. So if you're in areas that it's impacted right now, this is definitely a county kind of response that is happening. That county response then goes up to the state level, or from a regional sometimes, and then to a state. So it's extremely important to make sure that you know where your connections are under that kind of hierarchy from a disaster response standpoint. So I can tell you here where I'm at locally. It's definitely something that I'm in a small community hospital, right? So it's something that my resources are extremely limited. And so we really had to rely on the county to be able to help pull us those resources to us to be able to get the supplies that we needed. And even from a staffing perspective, to get staff into the hospital that we need. So my suggestions for that is, again, is just make sure that you connect back out with your county emergency operations center and find out what those resources are they can help bring to you, or they'll help navigate those so that way you can get those patients into a center that needs help. So the hospital necessarily per se cannot just limit their resources to you, because once it's declared a disaster, those resources are kind of are open up essentially to the community. So
Mike, one more question before we move a little bit more into self-care from another attendee. We're struggling with fellow nurses and doctors who are not taking this seriously by using proper PPE and placing patients in appropriate isolation precautions. Any suggestion how to approach this while maintaining peace at work?
Yes. I'll tell you what a struggle. We kind of jokingly talk about it about when was the last time that ED nurses and even our EMS partners really worried about isolation and proper PPE, right? Because, I mean, face it, on a normal day basis, we don't necessarily do the greatest job, right? So you have all those memes out there about, ICU nurses, and they're all garbed up, head to toe, and their isolation equipment, but yet then there's the ED nurse, running into the battle, right, with nothing at all. And so this is the struggle that we face right now, is because we really have to change our culture around PPE and isolation and making sure that we're doing it correctly. And so what I have had to do here with my own staff, and it's a constant everyday struggle. You feel like sometimes you're hitting your head up against the wall. Trust me, I get it. It's just reassuring them about what the best practices are and printing out the CDC guidelines. Again, you can find that on our resource page for you about the PPE that is needed for these patients. Thankfully, the information has kind of calmed down a little bit as far as around PPE and just around what kind of isolation you should be using versus when we first went live back to this in January, like I said, it was constantly changing as far as the level of PPE that we're using. So my suggestion is keep just printing those out, just hang in there. I know you're feeling frustrated because it's like you're repeating yourself over and over again, but it will make a difference. I can tell you, I've noticed that change within my own team here, whether my physicians and my nursing staff. So, and a lot of it is driven by my own peer nurses. So if you can get a couple other key people with you to help kind of push that message and become like champions, essentially, we call them the COVID czar is what we're calling them right now. And so they're the experts kind of within the department as far as PPE and our isolation process and kind of all that. Use that and see if that makes a difference for you.
So Mike, onto the self-care questions. We've got one here. What would be the best way to help our colleagues who may suffer psychologically after the crisis of pandemic passes? We rarely care for ourselves, and will people recognize they need help or seek it? This is being equated to working in a war zone.
Yeah, totally. I've never worked in a war zone. I have several of my members of my staff that have, though. And that's what they talked about, is that unknown, that uncertainty does feel very much like a war zone for them. So one of the things that we're really stressing within my organization is, and most organizations have like an EAP, Employee Assistance Program, is to be able to tap into. So those are always great resources that are free for people. And it's really is making sure that you guys are setting up debriefs kind of within your own institution. So especially after a rough night or a rough day, I keep saying night, but it could be a day shift, whatever the case may be, is that you're touching base with each other and checking in to see how people are doing, right? You guys know your peers the most because you work directly with them. So is there a change in their behavior that you're noticing? Are they calling out all of a sudden that they're not really sick? Are they just saying comments to you that makes you be concerned about them. Let them know that you're there as a friend for them and to offer resources. Like I said, ENA's webpage, we have a bunch of resources that are there for you that are free to our members kind of as we go through this process, and then also during that recovery phase. We know that recovery phase from a disaster perspective is most important to make sure that we get our peers back up and are supported. So just hang in there. Again, this is a marathon, so this isn't a sprint. We're going to get through this together, and that's what we'll do at the end of the day. So
our next question, Mike, what grief resources are available to help those healthcare workers who lose a colleague to COVID-19 and must continue working in the same difficult environment?
Yeah, so, you know, ENA right now, and I actually don't believe that we have any resources right off the top of the bat for that one, but it's something that we can potentially look at. Again, some of the counseling services that we do have as a member benefit right now around this can kind of help address that. Again, I would also tap into our EAP programs at your hospital, of your organization, because that's going to be a great resource. I can tell you here personally, in my emergency department that I manage, we actually had one of our ED techs a couple years ago, an avid kayaker that passed away on a kayaking trip, you know, totally unexpected. And so this is something that we face in our emergency departments at any time that this can happen to us. And so it's knowing what those resources are and, again, how to help each other through those difficult times. And when those things happen, you know, a lot of people don't want to talk about it in that moment in time. And that's okay, you know, it's to realize that everybody handles grief a little bit differently. And so just knowing that each other is there for each other when that moment in time is, that they want to be able to talk about it. So, like I said, just check in with your EAP programs at your hospitals, and then also make sure that you're checking out those resources that we have available for members on our ENA webpage there for you.
So I think we've got one more, at least one more self-care question coming through. Let's just hold on 1 second here. It's the fun of doing things live. Things are flying while we're moving here. 1 second here. And by the way, thank you to everyone who is submitting questions, and we appreciate your patience and understanding, knowing that we may not get to everything here today. So 1 more second, I think we've got one here. Yep. So talk about, Mike, you guys have been living with this for a while, and this is touching on self-care and kind of creeping a little bit into clinical, but talk a little bit about, you know, testing staff who are asymptomatic and maybe unintentionally infecting others in family. It seems like that's been a constant consideration that you've had to deal with, and every ED is dealing with right now. Talk a little bit about what your experience has been with that, and if you have any guidance for maybe what some other people can bring back to their EDs.
Yeah, so definitely a struggle for sure, and I don't have a magic answer for it. So, I mean, thankfully that as we get more testing ramped up here in the States, people can get tested more easily. That's not right, words right, easier than what we did initially. So I'll tell you, when we initially went live, I say live with this, when we started with the outbreak of COVID, essentially testing was extremely strict, and essentially all of our testing had to go to CDC, so we actually had to get clearance before we could actually test anybody here. Thankfully, that's kind of lessened up a little bit, so we don't actually have to call every time we need to test somebody off of it. We do have some more capabilities to be able to test people locally, so that's been able to help us out to be able to test more people. You know, the literature isn't out there necessarily per se, and because we don't really know as far as just testing all healthcare workers, especially those that are asymptomatic. I'll tell you, one of the things that we actually just moved to here in my own institution was looking at those atypical presentations of COVID. So people that have lost their sense of an acute loss of smell or taste, or somebody with sore throats or somebody with GI issues. So we're really looking at those atypical presentations as well for screening our healthcare workers. And if they screen positive for one of those, then they have to contact our employee health department to see if we are going to test them for COVID. Every place is going to be a little bit different just because of the amount of resources that you have available to use for testing. So right now, actually, we just today went to mandatory masking for all for everybody that works in the hospital. So the only reason I don't have my mask on right now is because I'm in my private office, but otherwise, as soon as I leave my private office, I have to make sure that I have my mask on at all times. And again, to maintain that social distancing about 6 feet apart, is what we're also trying to encourage while we're here. Obviously, as we're caring for patients, that's not always necessary to do. And so we really have to be focusing back on that simple hand hygiene and making sure that people are gelling and washing their hands numerous times a day. So we have gel stations kind of all throughout the department. Obviously, they're all by all the rooms, but also we have the individual dispensers kind of throughout the nurses station as well. So.
We have one observation that we want to share and to get some perspectives from you on Mike, and then we can move over to clinical. So this observation is that with this crisis, there's no touching, there's no hugging. And we know that dopamine and oxytocin released by a hug can dramatically bring down the levels of cortisol in your body, thereby pulling the brain out of danger response and giving it relief. So Mike, in 2 months of living in this environment and the constantly changing scenarios and the stress that comes with that, I mean, how do you, how is everybody staying connected in a way that is supportive, but also respectful of what this situation is and how that impacts personal contact and things of that nature that could be supportive and just showing that you care?
Right. Yeah, and all transparency, here in my emergency department, like you'll still see staff that will hug each other, give each other a high five or whatnot after something that's going on to show each other support. It's kind of funny, actually, we joked about the fact that they'll all be gowned up in their PPE that's clean, they haven't gone into their room or whatnot, and like they'll give each other hugs because it's the cleanest hug because, they're all in clean PPE. So we'll still see those connections. We actually have a Facebook group within our emergency department, and so people are posting out comments and messaging and funny kind of things. And what I really, stress to my team is making sure that they're finding the light, right? So what is it, some funny event that has happened, some way to make fun of something, I mean, it's just those small things to be able to say, that we're grateful for what we have and not try to hang up on the gloom and gloom of things, but really trying to find something positive. And so that's what I really stress to everybody through this, again, from a marathon standpoint, right? Is that we need to make sure that we're finding positives in everything that's going on. Turn off the social media platforms, turn off that news and stuff, and find a positive in life because that is truly what's going to make a difference for us. So I know we probably can go on for self-care here and on, but let's move to a couple of things with the clinical stuff as well. So if you're not aware, so ENA has a partnership with a firm. And so actually, ENA has actually donated some money to the firm partnership. And this is actually a chance to be able to get more PPE to the front lines. Trust me, I know the struggles of not having enough PPE. I mean, who ever thought that we were going to have to wear an N95 mask for a week at a time, and keep the same N95? Who knew that we were going to be rationing isolation gowns? So trust me, I hear you. My office has actually became I feel like I'm a hoarder right now because for any supplies that come into the emergency department for PPE, I have to maintain them in my office, and then I have to push them out to my department. So trust me, I understand the struggles to have PPE off of it. So ENA is trying to do our part to make sure that we can get you the resources that are available for you. So again, one of the biggest things is making sure that you're staying on top of what the PPE recommendations are locally. So CDC has their guidelines. Unfortunately, every institution is going to be operating a little bit differently with their infection prevention or infection control, whatever you call them at your institution. So make sure that you're staying on top of those resources that you have locally. And that's why one of the things that we've done is created that COVID czar, essentially. So these are my experts within my department, so that way they're staying on top of what the PPE requirements are, and really to make sure that people are staying safe and that they're doing the PPE appropriately. So anytime that we're going into a room, and we initially started with donning and doffing, so kind of the whole continuum that we have somebody watching you. Right now, it's just really is when somebody's doffing their equipment that we have somebody watching them, so that way that we're making sure that they're staying safe through that process. And so, but again, I just have to reiterate, make sure that you know what your institution's policies or procedures are around that, because they are going to change for every different place. ENA's created some visual abstracts as well on the webpage, on the ENA, on the COVID resource page. So if you scroll down to the bottom, you'll see some awesome infographics that are there for you as far as strategies for optimizing PPE and how to maintain your safety with that.
So Mike, we've got, as you might imagine, a number of questions that are coming in on clinical topics, including PPE. So we're going to try to get through as many of these as we can. The first one is actually a two-part question. Starts off, what level of PPE for droplet and airborne does ENA recommend for ED nurse safety? Because evidence conflicts on that. And then the follow-up to that was, what stance does ENA, if any, does ENA have on preparation of nurses from other specialties? What should they be? What should they know? What should they have when being assigned to the ED during this surge?
Yeah. So, all right. So the first question was, I'm sorry, was what?
So what level of PPE does ENA recommend relating to droplet and airborne for ED nurse safety?
Okay. Yeah. So the recommendations that ENA has to do is give back to CDC, which, granted, trust me, I understand that those recommendations are controversial. There's a lot of different competing literature that's out there about it as well. And so this is why ENA has actually put out there as well, is that, we want to make sure that the CDC guidelines are not being changed just because of lack of supply chain, right? So initially, when COVID came into the States, everything was airborne. Then that got changed down to essentially droplet unless you're doing an aerosolizing procedure, and then you do your full level airborne precautions. So right now, again, and this is why I had to stress to go back to your institution's policy, because every institution is going to be different as far as how they handle their PPE requirements. So ENA stance is, though, that we have to go to CDC's guidelines and the World Health Organization guidelines on what they're currently recommending. But again, check with your own institutions. As far as the comment, as far as other people that are coming down in your department to be able to help you out. So I can actually put out, I'll post something on the ENA Connect community. I might have already done it, maybe not. I know I sent it to a couple people as far as what we're doing here locally as well. So Society of Critical Care Medicine, they actually have a great presentation as far as tiered nursing and what that looks like. It's back to team nursing. So if you've been around long enough where you did team nursing, that's really what the recommendation of that is. So what I'll do is I will get you on the ENA Connect information on the community. I will post those documents, what we're doing here and what our competency sheets are as well. So I'm going to write that down before I forget, but yeah, I'll post that so that way you can see. If you have not checked out the ENA Connect community, there is a bunch of questions that have been going on there as well. So please make sure that you're checking out those communities, because we are sharing policies and procedures out there as well.
So Mike, this is somewhat related, but another two-parter. What is the recommended PPE level for PUIs in the ED? And is there any word on a national recommendation to start enteric testing for COVID-19? So
as far as, so again, we have to kind of go back to what CDC and the World Health Organizations are saying as far as their isolation and PPE requirements. For PUIs, I'll let you know what we're doing currently right now here in the department is that they're droplets with contact precautions, unless we're doing aerosolizing treatment, which then we go into our airborne isolation requirements. So that's what we're doing here locally. But again, you have to consult with your local infection prevention, infection control people to find out what your policies are.
So next question is not necessarily PPE related, but within the clinical realm. What is the best way to handle a situation that is out of your scope, but the patient is in danger? I have a friend who works in a hospital as a tech, so she is not allowed to titrate oxygen, but the nurse wanted her, but she didn't want to come in the COVID room.
Yikes. Well, so I have to say, we always have to maintain our scope of practice, right? I would never want somebody to be jeopardized from their license or certification due to scope of practice issues. However, also, I mean, again, I'm kind of torn, right? I mean, so, wearing a manager's hat, I have to say, always maintain your scope of practice, but also I'm going to say, do what's right for the patient as well, right? I mean, we all get in this to do no harm for our patient. So if I was that tech in that position, most likely I would probably increase that oxygen up if the nurse is telling me to do that. Essentially, they're giving me an order to be able to do that. But then I would also make sure that I follow back up with my leadership team to say, hey, this was the issue that was going on and the nurse was refusing to go into the room, because that's a whole nother conversation that needs to happen if a nurse is refusing to go in to care for the patient when the patient is in distress and needs that help.
So this is a little bit of relationship advice here. So, put on your Dear Abby hat, Mike. How should you approach doctors that don't want to assess a patient with COVID symptoms? This commenter, mentioned that some doctors are just assessing from the door. Some thoughts on that?
Oh, yes. I have plenty of thoughts for that. And this is something that we've struggled with. In fact, I was just on a call the other day. So one of the things that they want to look at is doing telehealth in the ED. So the ED doc can, do telehealth with the patient, and so that the nurse is there in the room instead of the doc. And so my question always is, okay, so we're saying essentially that it's okay to use the nurse and expose the nurse, but it's not okay to expose the doc. I'm like, that's a very hard sell that I'm never going to get on board with as a manager, definitely. And so, we've had conversations with my medical director about that, if we would have any of his providers that would have those issues. Thankfully, I don't have any of my providers that are having those issues, being able to go in and see a patient. But we kind of talked about that. What does that look like? And so, unfortunately, I don't have a magic answer for that. What I would say is talk to your medical director though as well, because by law they do have to go in and assess the patient still right now, unless your institution has waived on who's doing the medical screening exam for the patient and that the nurse has been clinically checked off to do medical screening exam. The provider technically still has to go in and assess that patient to perform the medical screening exam on their own tele.
So this is maybe a little bit on the procedural side, but also ties into clinical. The question is really, how are people documenting and handling, keeping their notes, writing their after action report, really with the mindset of having all this material available and have that literature available for the next time, and how to adapt disaster plans based off of what you've been experiencing now. It seems like something you guys would be talking about considerably over the last couple of months.
Yeah, so we have, so every institution is going to be doing it a little bit differently as far as how they get their information and do their after action reviews. And again, it depends on, how your state and county or your region is set up from a disaster preparedness standpoint on how some of that information is going to flow. So I can tell you here where I'm at locally. So again, I'm a part of the healthcare system. And so the hospital here, we have our own after action stuff that we're already working on. So we have a big Excel spreadsheet with our issues logs. So that way we're capturing some of this stuff. That rolls up to our system, which is a 7 emergency department, 5 hospital system, which then we're part of a much larger national system as well. So that information is going to be rolled up to that national area as well from a hospital standpoint. In addition, though, I also have my region that we report to, and where my hospital is compared to the rest of the hospitals within my system, we're in a different county, which is always a different challenge because we report through a different county emergency management system than the rest of my system does. So, so it's a little bit interesting and a little bit challenging because we have multiple different counties that we report to from a disaster perspective. But then also, there's a bigger regional kind of disaster standpoint that we stand up with. So again, it's going to be very particular to your own institution, where you're at within your county, within your region, on how that emergency management system is set up. I know anytime that we have any kind of these larger scale events, everybody's going to be doing after action reviews. And that's always the question, is how do we get that information back out to other people so that way they can do lessons learned for that next event and how we can be prepared. So hopefully, from a national level with our federal government partners, that we'll see a lot more around after action reviews that will be happening after this.
So Mike, we got a couple more, we have a comment and then a question on the clinical side, and then we'll move into some more ENATogether items. This is a comment which I think is sort of related to the uniqueness or what each facility is doing. This question or this comment says, in Israel, the staff wears hospital provided scrubs, which are laundered by the hospital, and the staff shower at the end of their shift and then don their own clothes to go home. They're wondering what nurses and other healthcare workers are doing, if they're doing the same type of thing, or maybe you could talk about what you're doing there, Mike, and if there's been sort of rationale about why do one thing versus another when it comes to what you're wearing there and what you wear coming into the hospital, those types of situations.
Yeah, so obviously this is going to be very institutional dependent. It's all going to depend, honestly, on what supplies you're able to get. So I can let you know, so currently, or so initially, my staff were instructed to wear in a pair of scrubs, and then we have a shower here, they could shower, but change out of their scrubs, put on new clothes, street clothes, and whatnot before they go home, right? We were finally able to get hospital-issued scrubs in for them, so I do offer my staff scrubs here that we launder for them. So again, they're instructed, though, to wear in their own scrubs, to change into our hospital-issued scrubs, and then change back out prior to going home. So we were luckily enough able to have that resource available for my staff. Not every institution is able to do that. I understand. So my recommendations, if you don't have that luxury of being able to have hospital-issued scrubs, is just to make sure that you have a process to be able to change out of your scrubs from your work environment before you transition home. So I know we have people that I've had stories where people go, they change from their regular scrubs, put street clothes on, go home, they get out, they wipe down their car, all their clothes are in a bag outside their house, they go inside, they shower at their house, and then they throw their clothes directly into the washer at home. So again, it kind of depends on what resources that you have available and what your setup is.
So Mike, our last question, it falls pretty heavily into the clinical area. It focuses back on PPE, particularly N95. This commenter says, I have a concern about facilities sterilizing N95 using techniques such as UV lights that, according to the manufacturer, render the mask ineffective. And the question is really focused around what is ENA doing to communicate the safety risk of this practice, but certainly this ties into how ENA is using its voice in various places to talk about the PPE issue in general. So I don't know that we can talk necessarily about what ENA is saying about this particular thing, but can you talk a little bit about PPE and how we've really have spoken up on this?
Yeah, so I'll tell you from the very get-go, this has been my biggest concern is around PPE and lack of supply of PPE. And so we had numerous meetings with our federal partners and the federal government about this. Ron Kraus, our 2021 president, actually was in a meeting with President Trump where he talked about this and the fact that, there is not enough PPE. And asking a nurse to all of a sudden use the same mask, for the whole shift or for a week at a time, that's not a normal process. That's not what we do. And so it's not okay from our standpoint, right? Because that is not what we do. So trust me, as far as the re-sterilization of surgical masks or N95s, I'm in the same boat with you as far as I don't understand this, what I keep being told is that the FDA has approved these techniques to be able to do them and that they're safe. Again, I don't know. I haven't seen that literature. I haven't seen that research on that yet. I'll tell you where I'm at. We are recycling. So we do have recycling containers for people to put in their N95 masks or their surgical masks that they're wearing, that they are being shipped off to a vendor to be reprocessed, to be re-sterilized. Due to some of our concerns that we have raised up as a system, they're doing a different process than what was initially said. But ENA is not going to be silent on this. We continue to push that we need to have more PPE on the front lines for you to maintain your own safety, to be able to care for our patients, and we're not going to give up on that message. So can we go to the next slide here as far as some of the ENATogether? Awesome, thanks. So one of the things I do want to make sure that you all are aware of is that the ENA Foundation has created a new COVID-19 relief fund. So this fund is for you as members to be able to apply for these grants, to be able to help offset anything that you're experiencing. So I know that some of our members, due to the volumes in their EDs, have been cut short on their shifts. They may have extra child care expenses that they have to pay. So this is a great opportunity for you to be able to, that the foundation is giving to you to be able to pay it back and pay it forward, essentially. So it's a great resource for you there. So yeah, so just make sure that you take advantage of that. You can find information out on the ENA's webpage on that. So the foundation actually gave a $200,000 seed to this grant just to get that money going. People can donate to that as well. So if you're interested in donating money to the foundation for this relief fund to be able to help each other out, there's an option for you to be able to donate as well. So And then also I want you to be aware that there is a kudos board that was signed up to as well. And so talking about the kind of self-care, one of the things that I actually do is I go back out to this kudos board. This is a place where members of our community can post positive messages to you as the first responders of the healthcare system and saying thank you for everything that you're doing. So as you can see on the slide here, there's a bunch of different photos that people put out there. There's all these kind of comments and things. It's just a nice way to fill your heart and to say, hey, you know, that people do care about things that we're doing. Also, ENA has entered a partnership with Hilton and the Marriott to actually offer you free lodging in certain cities. So each program is ran a little bit differently. So to find out more information, visit ENA.org/Marriott, or beginning on Monday, you can go to ENA.org/Hilton to find out more information about these two great offerings between Hilton and Marriott for you as well. So, you know, again, I keep saying that we will get through this together, right? ENA is a family. You know, we kind of joke about the fact that sometimes, you know, when we're at a conference and everything, that it's like a big family reunion. And it is, right? Because we enjoy seeing each other and stuff. And so it's watching out for each other, making sure that we're all doing okay through this. That's how we're going to get through this together. And so anything that you can do for your peers to make sure that they're checking in, you're checking in with them and stuff, again, just make sure that you're taking care of yourself and taking care of each other.
So Mike, that's a perfect segue to one of our first questions as part of the support. You touched a little bit about how, you know, ENA is helping frontline ED nurses and other professionals through the hotel program. The ENA.org/together page is where you can find a lot of other ways that people are offering their support and ways that you can share with, you know, your family and your friends who maybe are not nurses, ways that they can help support us as well. But the million-dollar question that was tied to this comment was, will Emergency Nursing 2020 go on as planned? So why don't you clear the air right now about that and offer some information that might be helpful to folks who are a little unsure about what's going on.
Yeah, so trust me. ENA 20 right now is going as planned. Like, it better, nothing better derail this. Because we're going to have a big celebration when we get together in Vegas. So at this time, ENA 20 is still going great. I'll tell you, I was just on a conference call yesterday with a leadership team planning EN 20. We have some amazing things in the works. So it's still playing together. You know, if this continues, you know, we're continuing to monitor the situation and we'll let you know. But we're going to do everything that we can to make sure that EN 20 goes off just the way that it was scheduled to go. And in fact, maybe even bigger and better than what we initially had hoped for. So yeah, so hopefully you guys will hang in there with us. Like I said, it's a marathon. We'll get through this and we'll be celebrating at Vegas for EN 20. And I'll let you know that registration does open on May 13th as well for conference for that. So
our next question is focusing on TNC and ENPC, TNCC and ENPC, you know, asking what ENA is going to do about expiration dates beyond May. You know, this person is commenting, you know, we're a large organization that hosts a class every month or two, and we're already falling behind to keep up because of folks expiring. I know you can talk a little bit about what we've done first in March, but then again, this week there was some more information that went out about that.
Yeah, so so first off, I have to say kudos to the ENA staff. So when this first came up, so where we knew that COVID was kind of going rampant and that was definitely going to be impacting things. This was one of the things that as a board we talked with our staff, and essentially overnight, honestly, the ENA staff created a virtual platform to be able to template essentially to be able to do your TNCC or ENPC courses. So that is an option to be able to do some virtual classes as well. Obviously, we keep monitoring the federal recommendations as well. And I don't recall off the top of my head as far as what we've pushed out those expiration dates to. I know, I think it's August, right? Oh, look, I got a message. It's in August. So it is pushed back out to August. Again, we are going to continue monitoring the situation. Trust me, I'm in the same boat. I have my staff that have to have their TNCC as well. I typically teach courses as well. I'm not doing any of those right now. But we'll continue monitoring that, and we'll get you guys that information as soon as we can as well. Is there any more other questions right there, Dan?
See, we're pulling through a couple more.
Okay.
And why don't we, so this is,
okay.
Go ahead. So we've got one here that is focusing, we're digging through it. Thank you for everybody. We had a bunch that have been supplying questions, so we're just kind of keeping track of them. You know, this kind of touches on a couple different areas in terms of support, but as an observation, the point was made that many of us are struggling with not being at the front lines with our colleagues in areas that are hit harder, and some institutions are furloughing nurses and nurse practitioners because of low volumes. Yet you can't go elsewhere to help in those areas of need, and there are some feelings of guilt for not being able to help. Mike, do you have some thoughts on, you know, I think this seems like a common thing that nurses want to be where they can do the most good, but this is such a challenging situation. You know, what are some thoughts that you have on how people can cope with that and maybe not have a little bit of that survivor guilt, if you can call it that in this instance?
Yeah, so exactly right. That survivor's guilt is what I call it. I mean, so honestly, like I say, is that the fact that here in Washington, our volumes, we've kind of gone over our peak right now. And so my ED volumes are way down. You know, they're less than half of what our ED volumes typically are. And so I have a couple of my own staff that are actually going to be going to New York. Actually, they leave tomorrow to be able to help out. And of course, I'm like, well, I would love to go help out, right? Like, I mean, that's as emergency department nurses, right? We want to be on the front lines. We want to be able to help serve anytime that there's a disaster. Obviously, we all can't do that. So one of the things that we're actually going to be doing is that we're actually going to, I have one of my nurses is in charge of, I'm doing some posters that we're going to do some positive thoughts and things that we're going to send to different institutions that we know that are being hit hard right now. So one of the things that we know within ENA is that after any kind of sort of disaster, that we have sent cards to them or posters letting them know that we're thinking of that emergency department that's hit. And those are the most meaningful things to that emergency department is to truly understand that there's other people out there that care about them and that are supporting them. And so one of the things I would just suggest is, you know, think about doing something for those emergency departments that you know that are getting hit. So is it just creating a poster for them, you know, sending them a card or something like that, so that way they understand that you're thinking about them. Again, I would challenge you also to go out to our kudos board that we have out there, and you can put a positive message for people there as well, so that way they can see it. So, but also one of the things is that I want to know from you guys is how else can ENA help support you during these times? I know these are challenging times. With information is always changing. You know, it's unknown. If we all had a crystal ball and we could look into the future and see how this is all going to work out. But what other things do you need from us that, you know, that we can be doing to help support you during these times? So if you have thoughts, comments, you know, put it into the chat box there. I'll let you know some of those questions and things we're not obviously going to get to because we are going to run out of time here. But what will happen is that they can pull a report off of everything that's put in there. So we'll see all those questions. So if we missed you for some reason or we were unable to get to you, we'll have all that information and we'll be taking a look at that and figuring out what those responses are. We'll be responding directly to you if we can, or see what we can do to help support you as well.
So Mike, a couple of the things that are coming in, you know, in terms of suggestions, not necessarily questions, but I'll throw these out there so you can, you know, keep tabs on them, you know, and we can certainly address these things as we move forward from a staff and as an organizational perspective. Folks talking about asking us to be on the forefront of controversial issues. You know, they want us to continue to advocate for safe practice. You know, I'll share this, knowing that, as Mike pointed out, there's some members of the board of directors that are on here. You know, there's been a couple of comments, people who are thanking Mike and the board for their support and leadership and assistance, and saying it's comforting to know that you are supporting us. So I think that was fair to share, given everything that's been going on right now. And one other question, let me just flip around here for a second. This is actually, you know, if you don't mind, Mike, we'll jump back to one other question that's sort of procedural wise, and maybe you can offer some perspectives on. Question came in asking about nurses who are being constantly flexed at their facility or being asked to use PTO, you know, to account for some of the time factors that are going on here. You know, is there generally some ways that you can talk about how, I think you touched on about some of the staffing issues earlier, but just to recap a little bit, how, what nurses can do or what they, what they should keep in mind as they go through some of these issues with their, flex time and other things.
Yeah, so again, it's going to be very dependent kind of on your institution as far as, with flexing staff and what that looks like and what resources that you have available to you. One of the things, again, that I just have to make sure that you, everybody remembers is that the fact that we do have a foundation grant that is now available to our members as well. And this is, again, a great chance to be able to tap into some of the funds that the foundation has brought forward, again, to be able to pay it forward to our members. So, if you are being flexed off, off your shift and that you need some additional resources there, make sure that you're checking out that foundation grant fund. And I did see a message that popped through about somebody that got kicked off as well. Is just make sure that, remember that this is being recorded, so you can go back and you can hear this and play it over again. So if you did miss something, you do have that chance to be able to replay this as well for you. I do also want you to know that we're going to do more of these town hall meetings. This is a way for us to be able to connect with you. So we are looking at different themes or different kind of ways to be able to do these, to be able to connect with you as our members. I'll tell you, it's a little odd sitting here in my office, I was talking to a computer screen, but hopefully this is meaningful to you. I love being able to get you back the comments that are coming in and the questions and stuff. Again, ENA wants to be there for you to give you those tools and resources that you need. So, I can, again, just reiterate, going back out to the ENA Connect community as well. So if you have questions around policies and procedures, what people are doing, make sure that you're going out there and posting those questions on there. Our Emergency Management and Preparedness Committee is reviewing those questions and they're responding. I'm getting in there responding to questions. I know other people that have been on the front lines are responding to those questions as well. So just post your questions there as well, and we'll get you those resources that you need.
Mike, we have one more question and one more quick comment. Let me find this question. Hold on one second. All right, I've lost track of the question that was referred to. So we'll certainly address that when we move forward for future town halls. But I thought you would appreciate this, Mike. This comes from a retired ED nurse and talking about what we mentioned earlier, about feeling bad not being able to help out colleagues on the front line. So she offered this, and I want your absolute most expert response to this that you can offer within the clinical guidelines that we think are appropriate. But she said, even though she can't be there to work side by side with her colleagues, she brought homemade muffins and fudge to support them. What is your stance on that?
Man, talk about putting me on the spot. So I'll tell you my response. So my hospital's response versus my response. So my hospital's institution's response is that everything has to be coordinated centrally through, and we're not supposed to take donations. However, the joke is, well, if Mike doesn't know about it, it's okay. Which, what ED nurse doesn't like food, right? Honestly, transparency. And I can tell you, I've connected with multiple members of our community that have wanted to order in pizza for my staff, and we coordinate that. Again, honestly, it's anything, if your institutions that you're working with are willing to take it in, I'm like, good for you, go forward with it. It's those small gestures that truly do mean the biggest difference to people. So, I mean, yes, I would love to, like I tell my staff all the time, I wish I could, give them all raises right now. I wish I could make sure that we all have the amount of PPE that we need. Unfortunately, those things are kind of outside of my control. So what are those small things, though, that I can do to show that they're appreciated and that I truly care about everything that they do every single day? So those small little gestures might not seem like much, but it truly does make a big difference to somebody. So thank you for doing that. So again, I just want to say, thank you for everything that you guys are doing. Who knew that you're the nurse, and midwife, and the ENA's 50th anniversary would be celebrating the fact of highlighting, I shouldn't say celebrating, highlighting the role that nurses are doing. So thank you for being committed to care for your patients and communities. I just ask that, again, that you please make sure that you're taking care of yourselves and take care of each other. And remember, this is a marathon. We will get through this together. If there's anything that we can do from an ENA standpoint, please reach out and let us know. Reach out to your board of directors. Any of them would be more than happy to help you out, to give you guidance as well. Obviously, you can feel free to reach out to me at any point in time. So again, I just want to say thank you for everything that you do. It's truly an honor to be standing here beside you, getting through this. And again, we will get through this together. And I look forward to Vegas, where we're going to have a big party about to celebrate because we're through this all. So again, thank you so much.